Right now, it's our Health Minute with our friends at Direct Primary Care Associates. I believe on the phone should be Stacy Flowers, nurse practitioner with Direct Primary Care Associates. Stacy, happy Tuesday to you.
Hey, happy Tuesday.
Well, how's things going with you this morning?
It's much better that it's not a Monday.
It's definitely not Monday, so we're all getting set here Tuesday. Going to be another hot day out there, isn't it, Stacy?
It is going to be, yes.
Well, tell me a little bit, what are we going to talk about today? I know we have some great topics that we discuss each and every morning about this time, so tell us what's the topic today.
So we've talked about diabetes, and we've also talked about high blood pressure before, but today I want to talk about diabetic nephropathy, and that is damage to your kidneys that can be caused from diabetes. A lot of people with diabetes also will have blood pressure. So if you have both of those going on, your kidneys are getting a double hit. So what your kidneys do is they clean your blood. If they're damaged, waste and fluids build up in your blood instead of leaving your body. And this damage can happen long before you ever have symptoms. So it's very important for people with diabetes to get regular screenings for kidney disease, testing the urine, testing the blood as well to make sure those kidneys are functioning properly. If the damage continues, your kidneys could fail, meaning that you would eventually potentially need dialysis or a kidney transplant. So the way to slow kidney disease progression, if you have high blood pressure, if you have diabetes, is controlling those as best as you can and making sure that you're getting that regular follow-up with your primary care provider to make sure all of these things are in order. And if you don't have a primary care provider, or if you're having a hard time finding affordable health care in the Cleveland, Athens, or Dalton area, check us out.
Again, Stacy Flowers, nurse practitioner with Direct Primary Care Associates, talking to us a little bit today. You know, it seems like, Stacy, we talk a lot more about diabetes than we do a lot of other problems, health problems that people have these days. It seems to be more prominent, doesn't it?
It does. With our Western diet, it's definitely something that our culture promotes. We're a very food-centric culture. A lot of our entertainment is centered around food. And while there's nothing wrong with that, that does lead to a lot of overeating, overindulging, and just getting into some bad habits. And those bad habits generally start in those childhood years. So making sure that you're fostering healthy decision-making for your kids as they're working on those diet plans that kind of get ingrained in them at an early age.
Now, Stacy, again, I know you mentioned really the best way to get on top of this is to see your primary care physicians. But is there any telltale signs that you would say would be something, okay, if you're noticing some of these type symptoms, you definitely need to get to your Direct Primary Care Associate to where you can kind of at least get these screenings done?
Absolutely. So for diabetes, the 3 Ps, they call it polydipsia, polyphagia, and polyuria. So that's drinking excessively, eating excessively, and urinating excessively. Those are 3 key signs of diabetes. Also, if you do notice that you're just, feeling really weird after maybe a meal, that could be in a person who doesn't know that they have diabetes, they may not be able to quite put their finger on what that feeling is. But that's why it's such a good idea to have those regular screenings, because even those key things that I talked about that could be signs of diabetes, you can have no symptoms whatsoever. And so having people, when they reach those adult years, and even in the childhood years, if they are a higher risk individual, having those blood tests done at least yearly is a good screening tool for that. And for high blood pressure, it's called the silent killer, because a lot of times until your blood pressure is so high that it's causing significant damage, you don't notice it at all. But some things that people notice can be facial flushing, headaches, dizziness, and those are all reasons to check in with a primary care provider.
All right, good information again this morning from Stacy Flowers, nurse practitioner with Direct Primary Care Associates. Now, Stacy, as you mentioned, if people are wanting to use your guys' services to get these annual exams done, to be able to get these screenings done that you guys are offering, what's the best way to reach out to get more information about the services that you guys can help with?
You can check us out on our website, directpca.com. On our website, there are links that you can pull up all of our included services, all of our included labs and included medications, and really see what kind of value that you're getting for your monthly membership fee.
Well, Stacy, we appreciate the great information this morning as always, and we hope you have a great day today. We'll talk to you tomorrow.
Thank you, sir.